Right? Excellent. Welcome to another wonderful episode here, Jaws Podiatry. Today, it is raining. PRP. Third case of the day, PRP. Must be doing something right, I don't know. Anyways, again, welcome to another episode here, Jaws Podiatry. Another very, very interesting case, which I think a lot of people will definitely be able to relate, possibly, obviously, learn from. We have a very young gentleman who, for the last, we'll say, year, has been experiencing, he's sort of laughing at me because I tell everyone, whether they're 20, 30, 40, 50, 60, 70, 80 years old, everyone's young, right? We all get there. He's been battling this pain on the lateral aspect of the right ankle. Because of the length of time that the patient has been battling this pain, we decided to order an MRI, which revealed, verbatim, MRI. There is a longitudinal split partial tear of the peroneus brevis tendon adjacent to the distal tip of the fibula. I'm going to translate that for everyone. So we have two very important tendons that run right here on the side of the lower extremity, right? And they come together close here. They're called the peroneal tendons, the peroneus longus and the peroneus brevis. Brevis from the Latin word short, right? And they both travel together here. This is the fibula, and this is the base of the fifth metatarsal, okay? We have 1, 2, 3, 4, 5 metatarsals. And the brevis, okay, the longest, as you can see here, I made a little detour here. And let's go ahead and focus here. And let's say focus right here. So fibula, metatarsal, 1, 2, 3, 4, 5 metatarsals. Peroneus longus, brevis, they're together here. They make a little U-turn here. The brevis attaches to the base, and the longus, you see how I did this here? It goes underneath and it attaches somewhere else. The job of this tendon is to do, just relax, is to do this. You ready? This motion. This motion. Obviously, we use the peroneus brevis tendon every single day. And this young guy, he really loves to exercise and he likes to walk. So of course he's not getting any better. Can you guys imagine 1 year? So what I propose, just like I'm gonna go ahead and eventually post the other video, we're gonna go ahead and perform a percutaneous microtenotomy, also known as a dry needling. The dry needling, or how I present to the patient, more of an acupuncture type of technique. The percutaneous microtenotomy is a phenomenal treatment that complements the PRP or the stem cell therapy or anything that has to do with regenerative techniques. Okay. When do we use the microtenotomy? Chronic conditions, a year. If this was a month, no. 2, no. It has to be greater than 4, 6 months for it to really work. So this morning we did the other case. Now we're doing a different clinical presentation. Again, the patient has a split tear of the peroneus brevis tendon. So the first thing that we're gonna go ahead and do, okay, let's get a good, make sure that everyone sees everything perfect there. Okay. And the first part of the procedure, okay, let's now focus here. So the first thing that we do is, we've already demarcated everything, ultrasound, okay? And I'm just slowly, carefully fenestrating. Do we have a good visual there? Nice and clear? Okay. Excellent. A little bit more superficial here. That's it. So that's the first part of the procedure. That's it. That's it. Okay. And now we're gonna come in. Let's keep our visual here. I'm gonna have the patient kind of move his leg this way. And we've isolated here about 2.7 cc's of the patient's own plasma.
And now we're gonna go ahead and inject. Again, we don't need to inject all this. We just don't. We inject whatever we need, but we don't throw away PRP until we're definitely done. I always, just like in the previous video, I'm gonna tell the patient again, you will, if you do feel discomfort, any dull pain, just please let me know, okay? I need a yes.
Yes.
Thank you. So what we're gonna go ahead and do now is, again, we're gonna go ahead and come in through right here, slowly. I'm gonna start infiltrating a little bit. If you feel any discomfort, please let me know. How are you doing up there, sir?
I feel nothing at all.
Me neither. You're doing great. You're doing great. And I'm injecting slowly because I really want all that PRP to stay right there. Now I'm gonna go, Rosemary, stay right there. I'm gonna come in from the other side here. Right? Okay, here we go. We're gonna infiltrate a little bit more. Patient's doing absolutely fantastic. Phenomenal. You're doing great up there. How am I doing?
Great.
Thank you. I appreciate it.
Don't feel nothing.
Okay, so okay. There we go. Okay, so just to let the patient know, we're all done. Okay, so we're all done with the procedure. Just to recap everything that we did, patient had presented with a chronic pain to the right ankle times 1 year. We went ahead and, excuse me. Guys, we're filming, thank you. Dr. Fernandez, we're filming, thank you. To recap, I apologize, this crowd out there. To recap, patient presented with a chronic pain to the right ankle. We ordered an MRI which revealed a split tear of one important tendon on the side of the ankle. They're called the peroneus brevis tendon. Because of the chronic condition and the length of time that has gone by, we decided no cortisone, no physical therapy, nothing that at this time we know is not, that the body will not respond well to it. Our job is not to cure, our job is to make things better. So realistically speaking, for me to say and tell the patient, you're gonna feel 100% better in 2 weeks, that's not our business. Our business is to make patients better, okay? How much better? I don't care. You guys have all heard me say it before. I don't care, as long as the patient starts to get better. We will eventually implement a little physical therapy, but he did great today. We're gonna put on a boot. He's not gonna be happy, but that's exactly what he needs. Like always, www.jospodiatry.com, Instagram, Dr. Tojan.